This is one lesson that Duolingo taught me about neuroplasticity and rehabilitation. And that lesson is you can't hack or shortcut your way to changing your brain. I was talking to my wife the other day about the struggles that she's having about teaching our kids Vietnamese. We really want our kids to learn another language. Unfortunately, I only speak English and my wife does speak Vietnamese. The problem is it's really difficult to pass the language on to your kids when only one parent can actually speak the language. So I told her, you just have to not give them a choice and you only speak to them in Vietnamese, and eventually they'll pick up more and more vocabulary so they can talk to you. But we talked about how hard that is, and she mentioned that we could always use language learning apps like Duolingo. But when you really think about it, think of how many millions of people use Duolingo, but how many of them are actually able to speak a new language because they're using Duolingo. We know that Duolingo is a monster in usage with 500 million active users. The number of people that actually become fluent from it is likely very few. And this isn't a knock against Duolingo. It is probably one of the best tools that you could have in order to acquire vocabulary. But what we do know is that the brains of someone who acquires and speaks multiple languages is a lot different from the brain of someone who knows a lot of random vocabulary. And this is where I told my wife that learning a second language is really, really hard because it involves changing the brain. And there's one specific trait that separates people that are successful in changing their brain to learn a second language and those that don't. And that trait is uncommon effort. When it comes to behavioral change, the fact of the matter is most people are just going to fail whenever they try to do something. This is because most people only want to put a convenient amount of effort into trying to fix something. Whether that behavior change means learning a new language, changing their diet, exercising more, or yes, even rehabilitating things like concussion or vestibular disorders, most people want to put a convenient amount of effort into accomplishing that goal, meaning they only want to do enough that isn't going to be very disruptive to other aspects of their life. When we look at the 10 rules of neuroplasticity, which is basically the foundation of how our brains learn anything, I think it comes down to three of these more than anything else. And that's that repetition matters, intensity matters, and time matters. If we just focus on repetitions, intensity, and time, all the rest of this stuff would probably take care of itself. This is why one of the most important things that we ask patients on their initial consultation is, what are your goals? And second, are you willing to put enough time, repetition, and intensity into reaching those goals? Which what I'm really asking a patient is, are you willing to put a convenient amount of effort into getting better, or are you willing to put an uncommon amount of effort into getting better?